I'm Dr. Randeep Guleria. I'm currently the chairman of Internal Medicine, Respiratory Disorders and Sleep Disorders at Medanta, the Medicity, Gurgaon. Before this, I was the director and CEO of the All Indian Institute of Medical Sciences, New Delhi. Sleep medicine is, in my mind, an unrecognized epidemic which we see in our country. If we look at data which was there even before COVID, there was suggestion that sleep disturbances and especially sleep apnea was quite common as far as India was concerned. Epidemiological studies which were done in India suggested that if you looked at sleep apnea, then almost 10 to 25% of the population, the adult population, had features of sleep apnea. And if you looked at sleep apnea, obstructive sleep apnea with daytime somnolence or sleepiness during the day, it was almost up to the tune of 5%. Now with COVID, there has been other sleep disorders which have come, which have been related to alteration in work, people working from home, and whole disturbance as far as sleep hygiene and the sleep cycle is concerned. So in my mind, we are seeing an increasing number of cases who have sleep disturbances, both obstructive sleep apnea and sleep related other disorders. India is seeing a pandemic, or I would say an outbreak or a huge emergence of non-communicable diseases. If you look at the global burden of disease data, which is also published in the Lancet, the burden of disease has shifted from communicable diseases to non-communicable diseases. And we are seeing a huge number of cases of patients with non-communicable diseases, diabetes, hypertension, strokes, cancers, chronic respiratory diseases, chronic kidney diseases. This is now causing the major burden of disease. Almost 55 to 60% of burden of disease is now related to non-communicable diseases, and communicable diseases like maternal mortality, infections, neonatal deaths because of infection have come down significantly. But this has led to a new outbreak as far as disorders are concerned. And if we start looking at one factor which also tends to tie all of them together, that is sleep apnea. There is now a large body of data which suggests that obstructive sleep apnea, if it goes unrecognized, it also drives this whole outbreak or emergence of non-communicable diseases, whether it be diabetes, whether it be non-alcoholic fatty liver disease, cardiovascular diseases, or various other disorders. Therefore, I think what we are seeing is increase in number of non-communicable diseases driven by lifestyle modification, better treatment of infections, but also driven a lot by our alteration in sleep habit, and which is leading to problems as far as non-communicable diseases are concerned. So when we look at sleep disorders, really there is no policy or guidelines as far as India is concerned. If you look at obstructive sleep apnea, both in Europe, in the UK or abroad, you have to be evaluated whether you have obstructive sleep apnea before you can get even a driver's license. To get a driver's license, one has to make sure that you don't have obstructive sleep apnea. And if you do have obstructive sleep apnea, then you need to use a CPAP device before you are fit to be given a driver's license. The reason for this is that there is a large body of data which suggests that roadside accidents which are unexplained happen because drivers go off to sleep, especially when it's on highways. And therefore, this is something that one needs to prevent, because you can have a large number of morbidity and mortality which can affect bystanders for no fault of theirs. And therefore, it's important that we have policies in terms of what should be done when you get a driver's license, how should we diagnose sleep apnea to make sure that those who have this disease are not exposed to areas where they can cause harm not only to themselves but to others. This is also true for people who are handling delicate, let's say, instruments or devices or machines, and if they go off to sleep, then that can also cause significant degree of injury. Then we have the whole issue of people who now are working in call centers, and we need to have some guidelines as to what should be done, because this is also causing a huge alteration in their sleep cycle, leading to insomnia, mental health issues, depression, and all of this needs to be addressed in a holistic manner. So if you look at sleep disorders, and I would look at it from 2 points of view. One is obstructive sleep apnea. Obstructive sleep apnea is a sleep disorder where there is daytime somnolence, the person feels less alert during the day, there is drowsiness, it tends to fall off to sleep when they are doing some work, and therefore there is a loss of productivity if someone has obstructive sleep apnea which is not treated properly in terms of proper interventions. Then the other issue is those who are actually working late and are having less and less sleep in terms of the fact that they are getting sleep deprived. This also leads to both medical illnesses. We already discussed the whole issues of mental health, metabolic syndrome, but also decreases your efficiency, alertness and ability to work. So, sleep hygiene, early diagnosis of obstructive sleep apnea and interventions in terms of being able to prevent this is very important if we want to have more productivity and also decrease morbidity and mortality.